The children that we service here at the Violence Intervention Program are children who have been impacted by some type of trauma, whether it be child abuse, sexual abuse, physical abuse, neglect, or exposure to violence, domestic violence or community violence. Our mental health agency here has a great collaboration with the LAC USC Hub Clinic. Foster care children come through and they have an initial medical exam where they are cleared medically to go into foster care. The mental health component is what differs from other hospitals or other hub clinics in LA County. We have in-house, I should say, therapists that are able to do these assessments or screenings of these children to make the appropriate recommendations that are needed. We make the assessment and we determine, does this child have any delays that need to be addressed medically? Do they need a referral to a regional center or further psychological assessment? Children who experience trauma, not all, but many will definitely have been impacted either physically or cognitively and emotionally. And again, those three things, you cannot see them separately because they all end up really impacting each other. Through the use of these evidence-based practices, we're then able to help the child begin to recover through the work. And then a really neat part is that we can also add some ancillary services, such as art therapy. We have several therapists that are trained in art therapy. Many times if the child is young or even an adolescent, maybe they're not ready to vocalize what happened. So through the artwork, they're able to draw or just through sensory means show what has happened, bring out those inner monsters that they're dealing with and give them that safe space to do it. Another really neat thing that we have is the sand tray room downstairs, and it's really neat because it's another way where a child doesn't feel that they need to vocalize it. They can do it through the sand play. Parent-child interaction therapy is one of the techniques that we use here with caregivers, and it's really nice. It's working dyadically with the child and the caregiver, the parent, and really what that means is the caregiver is being coached and taught ways to enhance relationship skills with their child, as well as ways to manage behavioral issues. What makes it a lot more interesting is that the parent is being coached through a one-way mirror. So the clinician is on one side of the mirror and the caregiver has a bug in the ear where they're getting feedback from the clinician as to how to approach the child. They're playing, and then again the clinician gives feedback on how to build those skills. One thing that as a mental health program that we moved into was going out into the community, meaning providing the services in home, whether it be family therapy, individual therapy, or collateral work. Another way we expanded was also going into the schools. So we currently are at 10 schools throughout our area and are able to provide mental health services to the children. Trauma doesn't affect everyone in the same way. So some children may need a shorter length of treatment as opposed to a child that has been impacted in many different areas. Again, we're trying to prevent the homelessness, the juvenile delinquency, the educational failure. So there's a lot of different services that have been put into place to be supportive of the families. Part of that is, again, the way we approach it here at the Violence Intervention Program is where we have the medical component to it, we have the mental health, we have case managers that assist the families that, again, need help with housing or clothing or shelter. So we really want to help the whole family be able to sustain themselves and, again, meet their basic needs, so then they can focus on those emotional, those cognitive needs that a child may have. And a lot of what we see is a lot of the parents have been victims of child abuse themselves, so they didn't have the proper modeling. This is what they know, this is what they were taught, and by us being able to come into their lives, break that cycle, intervene and prevent, I would hope to, I'd like to think that we are making a difference to bring those numbers down.